Would you be surprised to know that there are more deaths in Greece in the period of time after the vaccination rollout than there were in the years before the pandemic? Now, there could be many reasons for that, but what I'm going to be taking you through is a very important paper looking at deaths due to COVID 19 versus deaths with COVID 19 in Athens, Greece. It helps to break down some facts. And critically, the thing I like about these data reports is that you can look at it from multiple angles. And for me, I've always been looking at everything through an autoimmune paradigm. So when I analyze data, I then take that view that what happens if there is spike mediated autoimmunity? Does that explain the unusual patterns? If you want to learn more about autoimmunity, I've put together a whole course on this. Autoimmunity 101 gives you a baseline as to what we're talking about. And in that, I talk about how it is relevant in terms of COVID and the COVID pandemic. This is critical because I use this framework to help predict almost everything that is happening in terms of the pandemic. So when I'm speaking about these things, what I'll usually do is take a paper, break down what it has said, look at the data, and after I've gone through everything, that's when you then challenge it looking through the lens of autoimmunity. And when you do that, almost consistently, it tells you where this makes sense. You'll see what happens by the end. What I've done with AI is a powerful thing when you can use it to do all the statistical analysis, apply the clinical knowledge, get it to answer the specific question, and you then come up with some incredible insights. So, this is what we're going to do here, just covering a few points. Now, you have to realize that this paper was specifically being done to clarify that question about deaths due to COVID and deaths with COVID. And what they found doesn't surprise a lot of people who thought that the whole situation was overblown, because in the summary here, in their abstract, they found that among the 530 in hospital deaths, the ones that were attributed to COVID 19 or registered as COVID 19, they found 45.28% were reassessed and were not directly attributable to COVID 19. So, what it meant is that when you looked at the numbers, you would have thought that all these patients or people were dying from COVID, but in reality, only a percentage of them were. That was at the time when the panic was greatest. That was at the time when there was a great need for people to do specific actions, lockdowns being one of them, and other ones that I won't mention about the elephant in the room. And so that use of fear and overblowing the numbers has done tremendous damage to trust in medicine and science. And I'll take you through what exactly they meant when they described the principle of with versus due to COVID. And to start off, you just have to know what they did. So this is a very valuable piece of insight into what they did in Greece. Here we have, I've highlighted it. They looked at in Athens region, they had about 7 hospitals. All the patients who died in the participating hospital between the 1st of January 2022 and August 2022 with COVID on their death certificate, they were then registered as a COVID death and they were included in the study. So you have to look firstly at the time frame, January to August 2022. This is the period of the time when the Omicron started to surge. So you have to remember that they weren't facing Delta at that point. Delta was a beast of a virus. They were facing Omicron, which was completely different in terms of presentation. And this is where the science comes in. Delta, the Delta variant had the predilection to go all the way deep into the lungs. And so it caused much more severe inflammation in the lungs, leading to a COVID-associated respiratory death. On the other hand, Omicron has a predilection for the upper airways, the sinuses, and the bronchi. And so it will tend to have more of a coughing bronchitis thing and sinus neurological issues. So they're two different kinds of viruses. That's a very important point to note. And so when you look at the way how death occurred, you have to take that into consideration. So they gave, for example, the difference, or they looked at how they classified these deaths. And you can see here, to classify each death, they used the data from three sources. One, the death certificate, if it had COVID on it. Two, the chart file of the patient, paper and electronic files. So this would have the information about their observations and so on and what was happening to them in hospital. And three, they interviewed the caring physician with a structured questionnaire. And so they were able to get from the caring physician whether or not the clinical pattern that was on the death certificate made sense. And so that's where they were looking at it. And they gave two examples as to how they were looking at it. And you can see here, this is what they considered a COVID death. For example, an in-hospital death of a patient who was admitted with recent onset fever, hypoxia, that means low oxygen levels, a positive test for SARS-CoV-2. They had chest infiltrates, makes perfect sense, and they needed oxygen. That is the prototype of severe or moderate COVID. And they were treated with standard COVID protocols, but died despite treatment. That was considered a death due to COVID. Completely accurate. Conversely, if you had a patient who was admitted for, say, routine surgery, but happened to test positive for SARS-CoV-2, had no COVID signs or symptoms, received no COVID treatment, and then died from a surgical complication, that was not a COVID death. And that, again, is completely accurate. You can't call that a COVID death, but because of the way how things were structured, if a patient had COVID-19, that COVID diagnosis still had to be put on the death certificate, but probably in part two, not in part one, not directly related to the death. But then it allowed those numbers to be conflated in terms of, or inflated. And that then allowed the narrative to be driven, which then led to people doing specific actions because they were scared out of their wits. That approach to medicine and science is wrong. They shouldn't have done that. And as yet, we still haven't had an apology about what was being done to the population. But you have to be careful, because the same people who did that in the context of blowing up the numbers, making it seem absolutely horrific, everybody was going to be at risk. If you got this, you would die. It made it sound like some kind of, Ebola. Those same people are now completely silent on the fact that COVID is still spreading. Now, you have to know that they weren't interested at one end, pretty good chance they're not interested at the other. And so don't get caught in the trap of saying there is no problem. Believe me, this is a beast of a virus. The fact that it is not killing people directly with severe COVID-19 doesn't mean it's not killing people, and do not underestimate it. As I said, the same people who blew up the numbers are now quietly leaving you to get infection after infection after infection, and they don't seem to be too concerned. The numbers out of Denmark are quite concerning. We're talking about a 12% mortality, a diagnosis, not severe disease. They just die. We don't know why. We don't seem to want to understand why. As I said, this is about narratives, not about science. Very important to differentiate. Here is another point that I've got in the paper. The vast majority of that patient population, 95.6%, had at least one comorbidity. we knew this from day one, which is why, not day one, maybe in the first few months. This is why I kept on saying we knew who was high risk. Why did you mandate it? Why? It was not scientific. You knew who the targets were. Yes, there was a small percentage of the population who were young and healthy, who had interferon autoantibodies, difficult to predict, who could have had severe disease, but we could have found ways to treat them. You didn't have to do what was done. That was part of the problem. One interesting thing that came out of the data here that's very important is just reflect on this. Coronary artery disease, 44.9%. It is way higher than anything else. And if you add in atrial fibrillation, granted there's going to be an overlap with them, you can see that heart-related conditions are way beyond even COPD, way beyond cancer. This, if you are clinical, does not make any logical sense if the virus is the primary cause of the severe disease. The other thing I've highlighted here, which I don't understand why they can't do, is that they have put the unvaccinated and partially vaccinated together in the same group. And I'm thinking they have it as 41.5%. And at this time, you had almost 75% of Greece was vaccinated. I think they should have separated this. Even if the partially vaccinated numbers were small, it should have been separated. I don't know why they think that somebody who had one vaccine is unvaccinated. They are not. They are, you can call them not fully vaccinated, but do not call them unvaccinated. It skews your numbers and it makes it appear that the data you are bringing is trying to support a specific narrative rather than being factual. I thought I'd highlight that point. Now, in terms of another part of the paper that I think is quite relevant, is that as I looked carefully at the numbers, and again, I remind you, in case you've come in late, they found that 45.28% of the diagnoses in the Omicron wave were not directly attributable to COVID-19. Now, this may be able to be extrapolated to other parts of the pandemic, but you have to remember in 2020, when there was just COVID circulating, anybody who came in with typical symptoms would have been severe COVID. Where we see a transition is when we have a population that is highly vaccinated. This is the bit that I think is really, really critical. And it's what I talk about when I talk about the COVID storm. Now, people don't like me talking about this, but it is really an important principle when it comes to understanding what is going on. And I have used this particular concept, sorry, I'll just put it here, as the COVID storm, is that if you have a population on the right that is highly immune primed through vaccination, and you have recurring COVID infection, that is the nemesis or the basis of a COVID storm. This is what I think is the real issue at the moment. And this is part of the reason why they're trying to distract you about all kinds of things, because the implications of what I'm saying are so significant that nobody will want to acknowledge it. Now, I understand that. But at some point, you can't just let people get sick and die. What are you going to do? That's so unethical. And so I can understand the hope. What's happening is that everybody's quietly hoping this is just going to disappear. That in another year, okay, then this will be past and it won't be a problem. The issue is, if you take the view of spike protein mediated autoimmune responses, doesn't matter the source of the spike protein, you will realize why this is so serious. Because if you are having recurring infections, that's a source of spike protein. And this is then pretty pretty serious. So let me show you as I tie this together what the numbers actually show. Okay. So when you analyze the paper, and I put a few slides together here so that you would be able to understand this, is that when you put it together, what we've got is that when we look at the period of time after vaccination had been rolled out in Greece, excess deaths remained elevated, even though respiratory COVID severity had declined because Omicron was just not as severe. And as an important point that I really don't understand why people don't get on this is that there was a higher mortality in the unvaccinated cohort if they had never been exposed and they had comorbidities. That was the high risk group. But if they had been exposed, whether or not their comorbidities were there, their risk of getting severe disease would crash right down to, unless they had interferon autoantibodies. So what it means is that whoever survived the first and second wave of COVID would suddenly almost have very low risk for severe COVID-19 and the COVID complications, because if the virus penetrates your mucosal barrier, gets into the bloodstream, that's where all the risk occurs. So when we look at this period here, we can then see why in that period, vaccinated individuals were overrepresented in deaths classified as with COVID-19, possibly from non-respiratory causes, autoimmune complications, accelerated comorbid decline. This is the COVID storm that I'm talking about. And this is the bit that is very difficult to understand if you are not actively looking at it. So again, I went through now the big numbers because at the end of the day, you have to ask with any intervention. I use this example simply. We could give everybody blood thinners who is over 65 to prevent or reduce the risk of atrial fibrillation associated strokes. And if you did that, you would find that it significantly declined. However, you would be killing people bleeding from all kinds of things. So if you don't look at all-cause mortality, you will not know if your intervention actually overall gave benefit. That's the point. So when we look overall, I then took annual deaths in Greece and I looked at from 2019 crude death rate per 1,000, and they got the total deaths per year. So in 2019, it was 124,000. The crude death rate was 11.7. This is very simple. It's not major statistics, so a statistician would probably have better systems, but I'm very simple. 2020, when you had COVID, it was 131,000, and that makes sense, higher than 2019. The crude death rate went up to 12.2. This is where it gets very strange. In 2021, it was 144,000 almost. Now, they did have the Delta wave, which was lethal, and so crude death rate went up to 13.6. But by 2022, they had vaccinated 75% of the population in Greece. But the crude death rate is still 130, technically 140,000, way above 125. And you can see here 13.4. In 2023, it came down, still above 2019. And 2024, it came down still above 2019. Now, you have to remember, if all these extra people died in 2020, 2021, 2022, 2020, and they are not there to die again in 2023 and 2024. So what should have happened is that these numbers should have come down significantly below this period of time if this was a normal situation. It's what they call mortality debt. When you look at the numbers, something isn't right. But I'm too simple. I just don't know, what is going on. I expected less people should be dying. The hospitals should be empty because all the people who were going to die died before. But something is just not right. Even more interesting, when I then did a comparison for the pre-COVID period, 2015 to 2019, it was approximately 799,000 deaths per year. That was this average period. But when you look at this, and I took out the 2020 and 2021 years, I just looked at 2022 to 2024 when it was just Omicron circulating. We are still 10,000 deaths per year higher with Omicron. That's almost 9,582 more deaths per year, despite the wide vaccine rollout. As I said, I'm too simple. I keep on being told about all these lives saved, and I'm thinking something doesn't seem right. I don't know. I need some help. So, final point here. When I put the spike-mediated autoimmunity interpretation, and you have to understand what I've done here. So what I do is, because I look through the paper, I do my analysis, and then I'm not a statistician. This is where now I love AI, because AI is an incredible statistician. And so now I can use AI to then do a deep dive on all the details about the paper. So then I say, listen, just consider the point that I'm saying about spike-mediated autoimmunity. Let's just assume that the spike protein is triggering autoimmune responses from whatever source. Tell me, does this make sense? So this is what I've done. And this is why I'm saying I'm pretty sure about what I'm saying, because I challenge it. I don't just think it, I make sure, because this thing normally is stuck on a narrative. If you just ask it a question, it will spit out all the wonderful things that have happened. So I usually then make it look at the raw data and say, does this make sense? And it then goes, no, it doesn't. It doesn't add up. So when I then challenge it with spike-mediated autoimmunity, this is what then comes up. Disproportionate deaths in the vaccinated cohort with, so not due to, with, they just had a diagnosis of COVID. So despite only 23 to 25% of the population being unvaccinated in 2022, 36.7% of the with COVID were in the unvaccinated, partially vaccinated, compared to 63.3% that were fully or booster vaccinated. Now you have to remember, it will be even less if you split this down into the unvaccinated, partially vaccinated. So it could easily be 70 to 30 or higher. Many of these deaths did not involve hypoxia, that's low oxygen saturations, or pneumonia, and lacked COVID-specific features. And here is the interpretation. In a spike-mediated autoimmune model, systemic spike protein exposure from whatever source, especially from repeated vaccination, may provoke immune dysregulation, which then leads to, as I said before, the COVID storm. I keep on saying the same thing over and over. If you just think about what I'm saying, forget a narrative for a minute if you've got one. Just reflect on what happens if the spike protein is driving the immune system to go into overdrive and attack itself. Just consider it. And when you consider that, you will realize why this is not going to go away. This will only get worse year on year because the virus is still circulating in a population that is immune primed. There is no easy way out of this. And this is why I said at the beginning, if you're interested, please just take a look at Autoimmunity 101. This is why I did this course, put it together, because I realized people need to understand what I'm talking about when I talk about autoimmunity. Friendly fire, your immune system, instead of attacking something else, attacks you. the template, diabetes, mechanisms behind COVID autoimmunity, how the infection will cause immune dysregulation, and critically what you can do. And it has all the questions and answers there as well that people had asked from that presentation. These are serious issues. And as I said, they will not go away by ignoring it. You may as well prepare for it. And that's what I'm suggesting that everyone does, because at the moment, you are being left to hang on your own. Nobody's saying anything. They're just hoping that COVID goes away and all the problems with it. Based on the spike autoimmune paradigm, the tide is just coming in. And if you stand there, it's not long before it goes over your shoulders and then your head. That's my advice. Thank you.